Thank you, Dr. Lynn Kuehler. Yes, you'll have to forgive me if I take a long pause now and then. I'm trying to get the wheels turning in my brain, but has been quite a day. So tonight we're going to talk about the vector-borne diseases and their effect in yaks. It still amazes me when I put these talks together, the lack of information there is on yaks. I mean, you literally have to dig and dig and dig to find the information. So, so vector-borne diseases, in case you're not familiar with them, they are diseases that are carried by an insect agent. And so they get into the animal either through biting or contact with mucous membranes. Some of these are also blood-borne. So the vector actually is just moving the blood from one to the other. So there are other ways that the diseases can be transmitted besides just the insect, but this would be the biological vector. One thing about all vector-borne diseases is they have a seasonal pattern that coincides with when the vector is out there. So it kind of makes them unique, and that we look for them at certain times of the year. And if we have something that occurs at a completely different time of year, we don't even consider it generally as a possibility. So the hemorrhagic diseases are where we're going to start. This would be epizootic hemorrhagic disease, or EHD. And the other one is blue tongue virus. So these are both viruses. They are both transmitted by a biting midge of the genus Culicoides. These hemorrhagic diseases tend to hit August and September, maybe a little bit into October, but generally August and September are the main months. So white-tailed deer are the animals most affected by the hemorrhagic diseases, especially EHD. So in this illustration, you've got a deer that's infected with the EHD virus. The midge bites the deer, and the virus will then replicate within that midge over a period of time. The eggs mature, and the female will deposit the eggs in environments like this, where it's kind of wet around, a lot of times it's around like a watering trough or places where the animals drink and make it kind of muddy. Most of these we have outbreaks are in really warm summers and also dry summers. So it's these areas that they get damp because the cattle or the yaks, whatever you have, are around these watering troughs. Okay, so this midge that bit this animal and got infected, after she's laid her eggs, can go ahead and start to bite other animals, and that's the way that spreads, right? So the midge bites the infected animal and then goes and bites one that's naive. So the climate conditions in warm nights, a lot of times these midges are more so at nighttime than they are during the day. It's usually not windy, and again, it's usually hot. Hotter the weather, the more of these diseases we see. So like this says, when there are abundant susceptible hosts, optimal environmental conditions can create a perfect storm for these EHD outbreaks. So the hemorrhagic diseases, the host range, domestic ruminants, many are susceptible to infection with both types of viruses, blue tongue and EHD. And I hear this an awful lot. People think that they're the same disease, and they're not. They're actually two distinct viruses. But they get confused because they have very similar presentation. Blue tongue virus tends to cause more severe diseases in sheep. And then it's usually subclinical or mild in cattle, and also in yaks as well. And then EHD virus is most of the time subclinical in cattle. Again, white-tailed deer are the main focus of EHD, but it does cross over into cattle and yaks, and you get subclinical infection generally, or it's mild disease. But there have been some severe outbreaks in the past. And our understanding of infection and disease is changing. Believe me, it's changing rapidly. And most of that is because our diagnostics are improving. So now we're able to recognize these diseases that before we couldn't prove that's what the cause was. And again, seasonality is really important in any of these vector-borne diseases. For example, with EHD, you can count on it. August and September, those are going to be your main months, maybe into October. Temperature and weather and temperature is important, because if it's really warm, you get faster egg incubation. The midges will hatch faster. You get more eggs per female and increased transmission. So it's kind of the things to think about with these vector-borne diseases. So EHD, focusing on this one first, it's considered non-contagious because it doesn't go from one animal to the other except through this vector, through the midge. So it's a viral disease of wild and domestic ruminants. There are 3 serotypes in the United States: EHD 1 and 2, and they were discovered back in the 50s, and then a new one, EHD 6, was first isolated in 2006. So we got a different strain that actually is starting to filter in, which makes disease worse. Whenever you have a new strain, it tends to be worse in the animals. Causes sudden death in white-tailed deer. And again, EHD and blue tongue are very similar diseases. They share a common vector and common host, and they produce similar diseases. Really, the only way we distinguish it is by test, but they are different viruses. So maybe that's only important to me, I'm not sure, but it is an important distinction. In the EHD, we think more of deer, blue tongue, more so sheep, and they are distinct. So EHD epidemiology, it has a long viremia. That means for instance, in cattle, once they get bitten by the midge and that virus starts replicating in the bloodstream, it goes on a long time. It can be a week to 2 weeks of that viremia. So anytime a midge bites that animal during that period of time when it's viremic, then that midge is infected and can go bite somebody else, bite a naive host. So cattle are considered an amplifying host, and that they can really make the disease worse because of that long viremia. Couple of things, the stability, that enzootic stability. One article I read, like in South Texas, where it's more tropical, a very high seroprevalence of EHD, but there's very, very little clinical disease, meaning that most of the animals there in that more tropical area had been exposed. So they had antibodies, they don't get sick. Different from that, the enzootic instability is when you get more northern or maybe like less tropical climates. So there's more clinical disease. You get a lower antibody counts, so you get more disease when this virus is around. The other opportunity for problems is when you move naive animals into an area that's endemic. So there's lots of vectors. For example, if you were to take an animal from here and move them into South Texas, it could be a problem where there's a lot of vectors, and we're not necessarily an endemic area in Kentucky. We're more of that instability that it's not wide exposure, but we've definitely got the disease here. So this was an interesting article. There was an outbreak in yaks in Colorado back in 2012. Don't know if anybody was involved in that. That's on this webinar. But there were 5 herds affected with EHD virus 2 between August and October. So the first cases of when this outbreak occurred were in a 4-year-old yak cow and her 2-month-old calf. And they presented with, both of them had fever. The conjunctiva of the eyes were swollen. So, that's all the pink area. The mucous membranes were all swollen around the eye. Breathing fast. Both of them developed sores, blisters on the dental pad, had difficulty eating because it was painful. Whole blood samples. When I talk about whole blood samples, that's blood that's drawn into a purple top tube, so it does not clot. And we usually use red top tubes, and that clots when we test serum. But for most of these viral diseases, we do a PCR test, and that's always on whole blood. So it's purple top tube. In this outbreak, they took blood, and they were both positive on PCR for EHD. They were negative for the other similar diseases. OHV2, or malignant catarrhal fever, is OHV2. Blue tongue, IBR, and BVD. So what are the signs in yaks? So again, it starts with fever, inappetence, lethargy, as many viruses do. The swollen conjunctiva, so the eyes are definitely involved. Some difficulty breathing. A lot of times they'll have a nasal discharge that's bloody or blood tinged. But the kind of the key thing we look for is these oral erosions and ulcers. So they have a lot of salivation, their mouth hurts. They might have some peeling of the skin around the nose and some bleeding from the mouth. So these lesions, these vesicular lesions just means it has a vesicle. So it's like a fluid filled blister. So get them on the gums, the dental pad, tongue, sometimes on the udder, sometimes on the hooves. And the reason this is important is that is any vesicular disease that happens in a ruminant is going to get the attention of any veterinarian that looks at them. Probably they're going to call the federal vet to come in and look at it, because it's always on our differential is foot and mouth disease. You get vesicular lesions with that. So it just kind of, it always makes us perk up and say, oh, this is a vesicle. Maybe we ought to call somebody and have them look at it just to make sure. And they usually take a swab it, and they'll send it to NVSL just to check it. So this is some pictures from that article. These were this one's dead. This is the adult yak. So you can see these oral erosions right there on the dental pad. And also look at that discharge from the nose. That's kind of bloody. A lot of these viruses cause what they call a vasculitis. So it causes the vessels, the blood vessels, to kind of leak. And that's where you get this pulmonary edema. So you get lots of fluid that gets into the lungs. And it's not really a pneumonia with bacteria like we traditionally think, but this is just more fluid buildup in the lungs, makes it very difficult to breathe. You can see all the foam here in the trachea. So a lot of times they'll end up dying from either the lung issue, or they've also got some hemorrhages other places as well. So these are hemorrhagic diseases. Again, it means there's a vasculitis and there's a lot of leakage of blood. So both of these died, and in that outbreak, not that many died actually. They were those two and maybe a couple of others, but there were several that were sick, but they recovered. So there's not a lot of treatment, of course, for viruses. the most important thing is that they're on a good, keeping them in a good plane of nutrition, making sure they have plenty of trace mineral, make sure they get their vaccinations annually for respiratory disease, because you don't want any of these viruses to come in and like overlap. So that's basically what you do, is try to get them as strong as possible, so when they do encounter something like this, they can survive it. Blue tongue virus as well does get in yaks. I did find a case of this one as well in a Belgian animal park. Weight loss, progressive weakness because they're not eating very much. Again, they get these ulcers and on the muzzle, and they get kind of crusty, some nasal discharge. You might see redness on the udder, and some blisters down there as well. The tongue, a lot of times in the blue tongue virus, given the name, is often swollen and cyanotic, which means it's blue colored and protruding from the mouth. It's a little bit hard to see, but you'll see the tongue hanging out there. And we do have similar situations here in Kentucky. I've had pictures sent to me in the past of cows just like this, with that tongue hanging out, big, swollen, blue. So definitely blue tongue is here as well. Again, it's spread by that same midge, biting midge, and at that same time of year, usually August, September. Any questions on those before we move to the hemolytic anemias?
Yeah, that last yak that you showed, where was that yak? That's not in the United States.
That's in Belgium.
Okay.
A Belgian zoo. Pretty though. It's interesting coat color.
And that midge, you mentioned that it's in white-tailed deer. Here in Colorado, we have mule deer. Does it cross over into mule deer as well?
Yes, it sure does.
All right.
And some antelope, I think, as well. I was reading it when I start to read these yak articles, I can find all different things, but there was one that was the coat color was associated with deafness in yaks, and I just glanced over it, so I need to go back and read again. But it was, I don't know if it was this color here, but this one's pretty unique. So the second type of vector-borne diseases are the hemolytic anemias. So, because before it was the hemorrhagic diseases, the hemolytic anemias are well, just like it sounds. It's taking the red blood cell and it lyses it or destroys it, and it creates an anemia. So anemia, for those that aren't familiar, is when the red blood cell count gets very low. And of course, red blood cells are used by their job in life is to carry oxygen, and they carry oxygen out to the tissues and the organs. So when you don't have enough red blood cells, you don't get enough oxygen where it needs to be. And so we have a couple of different ways this can happen. And again, this is vector-borne, so we see a majority of the problem. So a little bit later than the hemorrhagic diseases. These usually start in September, and their peak is in October, and we go in a little bit into November, at least here in Kentucky. And I'm sorry I can't give you a very good equivalent anywhere else in the United States, but I can tell you what we do have here. So the two diseases that cause the hemolytic anemias are anaplasmosis and tulariosis. So anaplasmosis is caused by bacteria, and tulariosis is caused by a protozoan. Both of these organisms attack the red blood cell, and both diseases are carried by ticks. They're very, very similar, and we can't tell them apart. You have to test. You have to do blood testing to differentiate them. Transmission is through blood transfer. And again, ticks are the biological vector. And what happens is with removal of these red blood cells, which in this disease, the spleen is actually what is pulling out the damaged red blood cells. So think about the spleen as being sort of a filter for the blood. And as these abnormal cells go through the spleen, it pulls them out of circulation. So not only do we get low red blood cell count, but the spleen actually gets tremendous. It gets huge because it's full of damaged red blood cells. So you see anemia, again, is the primary problem, and that results in production loss, can cause abortions, can cause mortality. If they survive the clinical part of this infection, meaning where they actually show signs of disease, if they survive it, they'll be infected for life. So these don't get cleared. They become carriers for life. So transmission, again, ticks are the most important biological vector. So they carry out part of that life cycle in the tick's intestine, and then it goes to their salivary glands. And the only reason that's really important is that biological vector keeps these diseases going. So it keeps it going over winter, because the ticks will overwinter, and then it can start back up again the next year. And biting flies can also transmit these diseases. Anything that moves blood from one animal to the other. We're very good at it with hypodermic needles. When we use the same needle for multiple animals, we can definitely spread these diseases too. And it can transmit to the fetus during pregnancy. And there's literally very little research on that. So we have no idea how often that actually happens, this transmission to the fetus. So in the lab, these are simple, super simple for us to diagnose when they have a hemolytic anemia, because you've got a massive spleen, which you see right here, which is maybe 3 to 4 times larger than it should be. And then also we see a lot of this icterus or jaundice, where its tissues are very yellow, and that is because of the hemolysis. And so they sort of look like Ritchie waters, if you're familiar with a Ritchie water, really bright yellow. We used to say like Dial soap, but I'm not sure everybody knows about Dial soap anymore. It's again, that yellow color. So easy for us to diagnose if you bring them to the lab. If you look at a blood smear, this is anaplasmosis. The bacteria, anaplasma, or you can see are these little dots. And that you think of these are the red blood cells. So the infected red blood cells have the bacteria right there on the margin, which is why the full name is Anaplasma marginale. It's on the margin of the red cell. So once they're infected with anaplasmosis, with the anaplasma bacteria, it takes a little bit for that to destroy the red cells. So like this is on the x-axis is weeks following transmission. On the y is the percentage of red blood cells affected. So it takes 2.5, almost 3 weeks for that bacteria to continue infecting, and then the red cells getting pulled out as well. When 40 to 50% of the red cells are actually destroyed, that's when we start seeing the signs of disease. So it might be 3 to 4 weeks after they're inoculated with it. All of it depends on the dose too. They got a big dose originally. It's going to move a whole lot faster. A small dose obviously is slower. Clinical signs in cattle, and it should be the same in yaks. Adult cows or bulls dead in the pasture. That's generally what we see. I'm not sure that's completely due to the disease. It may be that they're not checking their animals every day, but generally this is the one we see most often. They just find them dead. If they see them alive, they'll be isolated, lagging behind, staggering. Again, they're not getting oxygen to their muscles nor their brain. So they're having a hard time just because they're so weak, number one, but also they tend to get really aggressive, that they're not getting oxygen to the brain. So they're not normal. They're definitely not like they usually are. Most people will tell me, gosh, it was the sweetest cow or bull, and then all of a sudden they get really mean. So you'll see them go off feed. Sudden weight loss is another one. It just seems like they drop weight overnight. On physical exam, if you have a veterinarian come out, they'll have fever, have anemia, pale around the eyes. Anemia is kind of a tough one to diagnose by just looking at an animal. Pale around the eyes and the muzzle and the teats. If they take blood, they'll have, the blood will be really thin. It looks like grape Kool-Aid. And they have an increased heart rate and respiratory rate due to that thin blood. They're trying to move oxygen the best they can. After the first couple of days, if they survive, they're going to start developing those yellow mucous membranes, the icterus. And you might see some constipation and rumen stasis. So one way to look at anemia, this was what they did in New Zealand. They had a big tularemia outbreak in New Zealand, and they actually had a field anemia indicator card, which is an interesting way to do this. To hold the directions say hold the vulva open with one hand, and then hold that card against the vulva with the other hand, and evaluate the mucosa halfway down. So you can see the difference there. I mean, this is normal. 25 to 35% pack cell, and you can see the color over here should be kind of a nice kind of darker pink, and as they get more anemic, it gets lighter. This 15 to 19% lighter, and then this 10 to 14%, they're actually a little bit icteric there. And then if they're really anemic and get less than 10% pack cell, I mean, they're white. They're really white. So that's probably the best place to evaluate anemia. How is this actually described by producers? So I wrote down, this was some of the clinical history on the animals brought to the lab with these hemolytic anemias. So it'll be off feed, shaky. She went down. She was swaying, breathing hard, had a runny nose. So a lot of times, think about that. If you saw your animal swaying and breathing hard with a runny nose, you'd think pneumonia. But actually they're breathing hard because they're trying to move oxygen, trying to get more oxygen in, when that's really not the problem. The reason they're not getting enough oxygen is they don't have the red cells to carry it. Another history, cow was by herself. She tried to get, they tried to get her up to the barn, but she dropped dead on the way, foaming at the mouth. So that they don't get that good oxygen to the brain, to the organs, and they can absolutely drop dead with exercise. Fine one day, dead the next, eating one day, dead the next. And here's something that you'll often see with these hemolytic anemias. They'll have 2 or 3 cows die in the last week or so. So it tends to be in a group like that. So what do you do if a cow shows clinical signs of a hemolytic anemia? Be very careful with your stress and movement of affected animals. You want to minimize that, because again, any kind of stress or exercise can absolutely cause them to collapse and die. So you want to take those animals, they should be rested, given plenty of high quality feed and water, handled only when necessary. They got to be treated like they're in intensive care, basically. So treatment, here's where it gets a little bit tricky, I think, is that anaplasmosis is a bacteria. So the anaplasma is a bacteria, so we can treat it with antibiotics. The Theileria organism is actually a protozoan, so it doesn't respond to antibiotics. However, if you had one that was showing clinical signs, you'd want to give it the treatment, because you won't know which disease it is by just looking at the animal. Treatment for anaplasmosis is LA200, LA300, noromycin 300. So we need the oxytetracyclines at the label dose. There is also Baytril, a new well, it's not a new Baytril preparation, it's actually a new Baytril name. Baytril 100 CA1 is the first fluoroquinolone antibiotic that is labeled for treatment of clinical anaplasmosis. And so Baytril is going to likely become the drug of choice, because it tends to do a better job against anaplasmosis. And once treatment is initiated for anything showing clinical signs, the next step is to immediately begin feeding the rest of the herd chlorotetracycline at the control dose. So we're going to use that feed additive, CTC, at the control dose of 0.5 to 2 milligrams per pound of body weight per head per day, and keep them on that through the vector season, through the rest of the vector season. Again, there's no treatment available for Theileria because it's a protozoan other than supportive care. There was some, when New Zealand had their outbreak, they did do some blood transfusions on the very valuable animals, but that's not really something we can do in the field. And recovery takes 1 to 2 months, depending on how severe the anemia is. So just if you're not familiar with CTC or the feed additive CTC, one of the easy ways to get it in, well, it's an easy way to get it into cattle, but maybe not so much yaks, because they're picky. They're picky about mineral. But and you can get CTC plain as aramycin and just top dress the feed or mix it in feed if that's a better way for you to deliver it. But if they will eat mineral, you can buy one of these preparations, and they are actually formulated for control of anaplas. So they've got the CTC in there at 6,000 grams per ton. So these are a nice way to do it. And again, if your yak will eat mineral. I know in the past when I've done talks before, that's always the main complaint. Well, they just won't eat it. They don't like minerals. So may have to get a little more creative to get the CTC in there. Once they are through the clinical phase and you've treated anything that they got sick, they go into a convalescent phase, just where they're getting their red blood cells back again. But during that time when they're recovering, that's usually when they're going to abort, and they'll almost always abort their calves. It does take a couple of months to rebuild blood volume. And the important part of that is breeding bulls may be sterile for up to a year. So just remember, it has effects that can be long lasting from anaplasmosis until they get back up to speed again. And then they become chronic carriers. After that, there's no clinical signs. They remain carriers for the rest of their lives, but they don't get sick again. So it's really important to remember that once they hit that carrier state, they're not going to get sick again. And so the question always becomes, well, what do we do with them? We know they're carriers. Do we want to keep them in the herd or not? And what we really want to do with these diseases is get to the point where they're stable, endemic stability, so that, if the bugs are always going to be out there. So what we want them to do is actually get it and live through it, and then they won't get it again. That's sort of what we have to strive for, because these diseases aren't going away. And then again, this persistent infection, and when the animals recover, they do become persistently infected for life. So if you think about that, they're carrying that anaplasmosis or that Theileria organism. They are a source of infection for other naive animals. But once everybody gets infected, you don't really have any more problems anymore. That's the definition of being endemic. I used to use the example of chicken pox in people when we all got chicken pox, and then we didn't have to worry about it again. So sort of that same idea. Since we got the chicken pox vaccine, it's not quite as good of an illustration, but same idea. Once you've got the antibodies and you're protected, that's where you really want to be. Put this picture in here. Somebody had sent me this picture and said, "What's wrong with the cattle's ears?" You know, they were all turned in and turned over like that. And I said, I literally couldn't tell from the picture. I said, I don't know what it would be. You're gonna have to catch one. So they finally did and looked in those ears, and they were full of ticks. They were just chock full of ticks. So kind of think about that. We've got a lot of ticks. We don't usually think about them in cattle, but they do get them, especially in the ears, places where the skin is thin. So here's kind of this is where I'm gonna follow to end tonight, is with teilariosis, which is new. This is new to us. As of this last year was our first case in Kentucky. And actually I did read where teilaria has been diagnosed in yaks before, not in the US, but in Europe. So teilaria is the protozoan. Its protozoan parasite infects red blood cells. But here's the tricky part of this one. It's transmitted by this Asian longhorn tick to cattle, which is also new to this area. So there's no treatment for teilaria, but we can focus a lot of effort on tick control. And this disease is a little bit different. It has a spring peak, March and April, and also a fall peak like normal. And now I'll explain why here shortly. And this is always a big question, is, oh my gosh, is this new disease gonna be a problem for people? And it's not a human health risk, teilaria, but it is in animals. So all the states in red have had the teilaria cases in cattle. So this Asian longhorn tick is right here. And so when you think about that name, Asian longhorn, it's not longhorn because of the cattle, and it's because they have a kind of a horn on their head, which I'll show you here. It actually sticks out. It's sticking out towards us in this picture. So I think they sort of look like transformers when you get them up close like this, but that is a close-up of the Asian longhorn tick. And here's the reality is these things are horrible. The female Asian longhorn tick does not need a male to produce eggs, to mate and produce eggs. That's called parthenogenetic strains. So a male is not necessary to produce eggs and larvae, and the female can produce 1,000 to 2,000 offspring without mating. So if you think about that, everything on that ear, that's an ear, is female. So you don't have that 50% male like you normally think of. So they can get very prolific, very, very fast. And a single cow can become host to thousands of ticks that can cause death simply due to blood loss, even without the protozoan parasite. So the ticks themselves can cause death. And actually today, I got a call from the entomologist at UK and said there was a four-day-old calf here in Kentucky that was found today that had died from this tick. So it was covered in ticks, and they can suck so much blood so quickly that it just basically exsanguinated that calf. 4 days old. So the Asian longhorn tick is a 3-host tick. If you start here, the adults are generally in the middle of summer. They attach and feed for about a week to 2 weeks, fall off. That's when they'll lay their eggs. The eggs hatch, and these are larvae. The larvae are in the fall. So the larvae molt to form nymphs, and the nymphs overwinter on the ground. So once they're in the ground, come back here to the spring, and the nymph comes out in right about now, actually, March, April, and they attach and feed for a week or so, drop off, they'll molt to form an adult. So this is a 3-host tick. The nymphs can actually transmit the disease as well as the adults. So if these nymphs got infected before they overwintered and they come out in the spring, that's why we can have a small spring peak of disease. And then the other time is the adults can cause the disease. So first high risk transmission period is when they come out of dormancy, February, March. Second, from infected adult ticks, July and August. Once a cow's infected, it might take 1 to 8 weeks, 1 to 8 weeks before she shows symptoms of disease. So that's why they get infected maybe in August, but they don't actually show any problems until October, which is when we have our peak. So what do you do about this tick? Inspecting cattle, and I can only imagine it would be very hard to find a tick on a yak with long hair. It's hard enough on cattle. So there's 3 life stages of the longhorn tick. This is a good picture. This is a head of a pin. These things are tiny. They are tiny. This is a 1/8 inch scale right here. So the adult, about 1/8 of an inch, larvae, and the nymph, all very small. Light brown, often smaller than a sesame seed. The adult female is about the size of a pea when she's full of blood. And you can have all 3 life stages on a cow at the same time. So where do you look? And this can get on people too. These get on livestock, pets, and humans. So you got to check yourself as well. But in cattle, you need to check any place the skin is thin, on the head, the neck, the ears, flanks, armpit, groin area, and the udder, under the tail. Cattle that seem lethargic or unthrifty should be closely inspected for ticks. And again, they are tiny, so that just gives you another shot at that size. So what do you do? How do you manage that population of ticks when they're on the cattle? Ticks spend most of their time, 90%, in the environment. So you don't get a whole lot of control on the animal, but it still helps. These tick repellents reduce the numbers that feed and develop into the next stage. They decrease egg numbers as well. You won't find any chemicals that are actually labeled for this Asian longhorn tick, but anything that's labeled for the American dog tick or Lone Star tick should work just as well on this tick. There are field reports of success with our dewormers, the macrocyclic lactones like Cydectin, Poron, and Dectomax injectable, and Ivomec as well. I've seen Ivomec used as a treatment. Think about this as well, treating cattle for ticks as they arrive to the farm, and also before moving cattle from one property to another. So always be thinking when you're bringing animals in, new ones to your farm, they may have those ticks on there. So you want to treat them before you move them out, on your property with your existing herd. Environmental control, there are a few things you can do as well to reduce them. Tick population in the environment. All stages like that, warm, damp conditions and long grass. So mowing pastures, especially places around where that's shaded where the cattle like to loaf, fencing them out of wooded areas, and avoid placing them in really long rank pasture that's not been grazed, because those brushy areas have a lot of ticks. And wildlife can serve as tick hosts and accelerate their spread too. So there, any wildlife like deer can also serve as a host. So that's all I've got for you all today. That's another shot of the anaplasmosis in the blood vessel. So any questions? I know that's a lot of information and some very difficult diseases to understand, but the important thing to know is that these are generally fall diseases, late summer, fall, with the exception of Towlaria's got that short one in the spring. And I think that helps us focus, helps us focus on when to test for these diseases.
Excellent. If you have any questions, you can unmute now, or you can type them into the chat. And Trisha's got one here. Dr. Arnold, is it possible that domestic ticks will eventually become infected with Teilaria?
I don't think so. I don't think so. They've had Teilaria in foreign countries for quite a while, and they've never seen it in any other type of tick. So at least that I've read. So I'm not sure what it is about that tick that makes it the host for that. I'm not an entomologist by trade, so I'm not exactly sure why, but that's a great question.
Dr. Arnold, go ahead.
I was just saying thank you.
Thank you.
Dr. Arnold, I'd seen a map. One of your colleagues from Virginia had shown a map of the potential range of the Asian longhorn tick. Mm-hmm. And yeah, I think originally it was found in New Jersey and then has spread down the East Coast and then has moved its way as far west as the southwest corner of Missouri. Mm-hmm. Which I assume was on some maybe feeder calves that moved from our area out there. But it's basically from the Plains state east is kind of the general range of which these ticks will likely be able to thrive. Is that a fair assessment?
And I think I wouldn't answer that. I don't know. Okay. I know I've seen those maps as well, and one thing I remember a couple of years ago when they first started talking about this tick is they didn't have the host range nearly big enough. It was a whole lot smaller, and then now that we've come a couple of years into it, the host range, it's getting bigger and bigger. So I think it's probably, we just don't know.
Okay.
I don't know what would slow it down, actually.
There was another question that came in from Trish. Do you know if there are any projections regarding the potential spread? So I think that
kind of pretty much answered just before, I guess. Bottom line is it's going to spread, it's going to be fast, and nobody really knows how far and what timeline.
Yeah, I mean, we don't know. And that one thing about Teilaria is it's not as severe as anaplasmosis. So they must have to have a concurrent stressor. For example, they've just calved, or they're in early lactation, or they've got some kind of like a mineral deficiency. Something has to be concurrent for them to have clinical signs from Teilaria. The anaplasma is not that way, but so I guess I would say it could be widespread, but it may not be as severe as we're afraid it could be, as we're afraid of. The unknown is always one of those things that it's like, oh my goodness, what's coming? But
Yeah, it sounds
I
like
don't think it's, I don't think it's gonna be quite that bad. I mean, we've seen it like in Virginia was where most of our information's coming from, and they certainly haven't had anything that's just something that would make the news, you know, where all the cattle are dying. Yeah, they've had some affected, but it's not been anything horrific.
okay, thanks.
Let's see. Dr. Arnold, Melissa asked if you could back up your slides on the to the point where it says how to treat before introducing them to a new herd.
Did I go too far? Let's see. Yeah, I probably did. Let's see here. Right there. Yeah. With so the ear tags, pour-on sprays, back rubs, and then again the microcyclic lactone dewormers like Cydectin, Dectomax, Avamec.
With permethrins and those, I assume, work as well.
They do. I follow the directions. Their organophosphates work very well, but you have to be careful on young animals with organophosphates. But the pyrethrins, you know, they're knockdowns. They don't typically last a long time. But anything labeled for ticks, which there's a lot of products that have a tick label. So that should work.
Another question came in from Urs. Are there any vaccines that we should specifically be thinking about to prevent EHD? US Yaks recommended a vaccine a few years ago, but it was not tested and it wasn't known about its safety, and particularly with pregnant yaks. So are we blindly vaccinating for EHD, or what are your thoughts on that?
We are not here. We are not here in Kentucky. I'm not aware of trying to think of it if I've seen anybody that I don't think there's one for EHD. I think there may be a blue tongue vaccine, but we don't typically use it. And I'm not familiar with it enough to comment on it really, on its safety.
And Michelle asked, what is the best schedule for thinking about 7-way, 8-way vaccines? And maybe we need to define 4 or 5 ways versus 7, 8 ways, etc. Right.
So when we think about 7 or 8-way vaccines, most of the time those are the blackleg vaccines or the clostridials, and that we definitely want to get into our calves because they're the most susceptible. We typically say to start them to give them their first dose of the 8-way or 7 or 8-way vaccine sometime in that 2, 3, 4 months of age. Give them the first dose, and then you give a booster dose according to the label directions. And then after that, usually another dose at weaning. And then after that, annually, you go with the clostridial vaccines. The other ones we talk about a lot with numbers would be either a 5-way, 4-way, 5-way vaccine. And those cover the respiratory viruses, IBR, BVD, PI3, and BRSV. Usually we want to start those about the same time as we start the clostridials. Sometimes if the herd's very healthy and doesn't buy a lot of cattle in or move or have a lot of nose-to-nose contact with other animals, sometimes they won't start those viral vaccines till about the time of weaning. It just depends on your situation. But so you want to at least get 2 doses of that viral vaccine, the 4-way, 5-way at weaning. or shortly after weaning, or shortly before weaning. And that's a whole nother lecture, depending on, you know, what type of vaccine you use. And then after that, you want to do vaccinate them again before breeding. So you want to get that in them again about a month to 6 weeks before breeding, and then annually after that. And that's just kind of the quick and dirty on the vaccines. There's a lot more. There's a lot more to talk about on vaccine, but it is important to get them some protection from those respiratory viruses. We actually this year have seen more pneumonia deaths in adult cattle, I think, than I've ever seen. So, and most of it was due to BRSV. You know, we saw a lot of human RSV this year. And in cattle, we saw a lot of the bovine form and the BRSV. And when it hits, once it hits, then they go into a bacterial pneumonia after that with Monheimia, and it's really quick. It is really quick. So it's always good. It's actually probably more important now than ever to make sure that your adults are vaccinated against those respiratory viruses.
Excellent. Shakur, welcome. He's joined us, and he said it's morning where he's at, and he made the comment that they don't really have a lot of issues with ticks, and probably because of the relatively high altitude, 5,000 meters above sea level, and thinking about being at that altitude, relatively low moisture, or probably more of a semi-arid area that would limit their spread. And so I think that's a good point, Shakur. We probably see more, especially in our region of the U.S., because we get somewhere between 50 to 70 inches of rainfall a year. So it's you know, almost 2 meters of rainfall a year here. So lots of moisture to keep some of these insects going for a very long time, and relatively mild winters. You know, we have I don't know, you could probably say less than 14 days where we are below freezing anymore, it seems like. So things tend to live a long time around here. But thanks for joining us, and we're always welcome, or happy to have you on, and we'd be welcome to give your thoughts as well on things that you see. Mike, thanks for joining in, and we're glad that you joined us. We will have this recording that we'll send out, so anybody that wants to follow up on this, or if you want to share it, you're welcome to share the link once we get it sent out, and I'll email that out very soon. Other questions for Dr. Arnold before we end this evening?
I have a couple questions. We're in Wyoming, and do ticks normally die? Our winters are pretty hard. Ticks normally die in the winter, correct?
Not necessarily. They can overwinter. They can they go through what they call diapause, where they just get down in the burrow down deep. Now, I don't know about Wyoming. You know, I don't know. Again, I'm not an entomologist by trade, but I know they do diapause over winter. And where this tick is now, I mean, it's up in New York, and you know, up in the Northeast. So, and it gets pretty cold up there. I said, I don't know the answer to that, but we'd have to get our entomologist, you know, looped in here to answer you for real.
Carlise, do you see many ticks on pets coming into the vet office there?
I can probably count in the 2 years, probably like 5 to 10, maybe, with a few.
Wow, that's nice.
Yeah. So I would say that they could, but probably not as heavy as what they're going to be as you move further south and where it's warmer and wetter.
Right.
And then my other question was, well, I guess I have 2 more questions. Deworming them with just pour-on prevents ticks, or would injectable, depending on the dewormer?
Either, yeah, well, we're just using the macrocyclic lactones if we're talking about ticks, but it can be either way, pour-on or injectable.
Okay. And then what are your recommendations? We were kind of talking about vaccinations on how often to deworm.
That's a great question because I was reading that today. And that kind of goes along with what we just said. We like here in Kentucky, we get so much rainfall and it doesn't get really cold. So we have lots of worm problems, parasite problems here that you probably don't have there. So a good rule of thumb is whenever grass is growing, that's when the parasites are the most active. You know, that's when you're going to have most of it in the pasture.
Right.
So that's kind of it here. Here we usually recommend in the spring, and then a second deworming in the fall. Usually we try to limit that to like the younger animals or the thinner ones, and that way we're not overdoing it. We're not creating some resistance issues.
And then I show my yaks quite a bit.
Mhm.
Some shows are where you have to deworm them to get into the show. Like when we like go to the show or come home from the show, would you recommend deworming them then as well, being around other livestock?
Not necessarily. If you're using a product like, you know, something like Cydectin or Dectomax, they've got a pretty long life. I mean, they last at least 40 days.
Okay.
So you wouldn't have to do them again when you got home. You might, you know what, if you were concerned about external parasites, you could just use some type of pyrethrin when you got home, and that would take care of your externals.
Okay. That's all the questions I had. Thank you.
Mm-hmm.
I had one last, I'm sorry. Do you mind one more question?
No, go ahead.
It's still regarding the vaccinations and deworming and transporting animals.
Mm-hmm.
How is there a timeline that you would request the person that you're buying or moving the animal to your facility to do this?
Well, that's an
is it
excellent
just according to
question.
package?
Yeah, that's an excellent question. You think about vaccines take at least a couple of weeks, 2 to 3 weeks to really become effective. So you want to at least, I like to think about a month ahead. If you could do a month ahead with your vaccines. And deworming, about the same. Most of our dewormers, if you're using injectable or pour-on, will at least give you 40 days. 40 days, 35 to 40. So if you were to do a month ahead, 3 weeks to a month ahead would be fine.
Okay, perfect. Thank you.
Mm-hmm.
Any other questions for Dr. Arnold? I don't see any. Actually, here's one. Dr. Arnold, would you be willing to make your slides available to folks if
Oh,
they
sure.
wanted them?
Yeah.
Okay. If you
Should I
could-
just send you the I'll send you the PDF of them?
Yep, that'd be
you-
great. And then I can
Okay.
send them out to the email list and they can be shot out that way.
Yeah, absolutely.
Fantastic.
Jeff,
Yes, go ahead, Greg.
one other good resource that Dr. Arnold does is she does a monthly article, and it's Cow and Pasture.
Cow Country News.
Cow Country News. It's a Kentucky cattleman's magazine, but it's online, and she does a health article every month. And for those who remember before, when I used to send out stuff several years ago, it was always articles that were clipped from what she had written, and she'd given us permission, but great information on all of this. And you know, it's once a month. Read it and take a look at what she's saying, because at least 80% will apply
Mm-hmm.
directly to your animals, even though they're called beef in the article. But they're great articles.
Thank you. Thank you. I
You're
appreciate
welcome.
that.
No, they're fantastic.
Excellent. Well, just a quick reminder, our next webinar will be April the 19th, and Dr. Bullock will be discussing developing breeding objectives and thinking about some different approaches maybe on breeding objectives, and he'll be interested in your feedback as well, because the beef approach to breeding and selection is a little bit different than what we tend to see on the yak side. But he's going to try to have you all begin thinking about developing objectives and then how to begin planning to meet those objectives. So again, that's April the 19th. It'll be the same time frame so that we can try to get folks on across the U.S. Dr. Arnold, thank you so much for being with us tonight. I know you've had a very long day since you've been up since 4. So thanks. We appreciate it. And we really want to thank you again for the great information you shared.
Oh, thank you all. And I'll send this to you in the morning. I'm
you.
done for today.
Thanks, Dr.
very
Arnold.
much.
Thanks.
Thank you all for joining us, and hopefully we'll see you next month.